Hello everyone, myself Shenaz and I welcome you all to my channel Nurses, the Heart of Healthcare. Before moving ahead, I would really appreciate if you all subscribe my channel Nurses, the Heart of Healthcare, and if you find the content helpful, easy and effective, then please do like, share and subscribe. The theme of this video is nursing interview questions and answers. In this video, we are going to discuss some of the very important and very frequently asked questions and answers in a nursing interview. So please focus. So when we are going for an interview, we have a lot of questions in our mind, like what type of questions we are going to face. Okay, see, nursing interview, it can be an individual who takes your interview, or it can be a team of members who are sitting right in front of you and asking, different questions. So the type of questions they are going to ask depends upon whether you are a fresher or an experienced candidate. And if you are experienced, from which department you have experience, means you have an experience from ward or ICU or emergency or OT, it depends. So based on what type of experience you have, they may ask you the questions. So in this video, we are going to discuss some of the very important questions that I myself has come across in most of my interviews. So let's begin. One of the very commonly asked question is regarding what are the indications of IV cannulation. Okay, the question is, what are the indications of IV cannulation? As we all know that IV cannulation is the most common procedure that we perform in wards, in ICUs, in emergency, okay, in operation theatre, okay, whichever area it is. Okay, so it is the most commonly performed procedure. What are the indications? The answer is, one is IV cannulation is done for fluid and electrolyte replacement. Okay, that is for IV fluid administration, and the other one is to administer IV medications, and the other one is for IV chemotherapy administration, and for IV nutritional support, for IV blood and blood products administration, for IV administration of anesthesia, for repeated blood sampling, for IV administration of radiological contrast agents for CT, MRI or nuclear imaging, and also for hemodynamic monitoring. Okay, so these are the various purposes or indications of IV cannulation. Okay. The next question that we are going to discuss is, what is antibiotic stewardship? Okay. What is antibiotic stewardship? So antibiotic means, it's a chemical that, it's a medicine or it's a drug that we are using to deal with the infections. And stewardship means it is like supervising or managing something. Okay. So when you combine this, the meaning that you get is, antibiotic stewardship refers to the efforts in all the healthcare settings to ensure that antibiotics are used only when necessary and appropriate. Okay, that means ensuring appropriate and proper use of antibiotics to combat antibiotic resistance. Okay, so this is antibiotic stewardship. Okay, so the aim of this is right antibiotic should be prescribed to the right patient at right dose at right time and for the right duration. Okay, so there we can see there it's given very clearly, it is to minimize the misuse or overuse of antibiotics. Okay, so that we can combat antibiotic resistance. See, why it is important is because alarming, there is an alarming new type of antibiotic resistant bacteria which are continuing to emerge. Okay, so that's the reason antibiotic stewardship, it plays a very important role, so that the bacteria, they don't get resistant to the antibiotics that are used. The more antibiotics are used, they become less effective. Okay, so that's the reason antibiotic stewardship plays a very important role to combat antibiotic resistance. Okay, proper antibiotic for at proper dose for proper duration to avoid misuse or overuse of the antibiotic. So this is antibiotic stewardship. I hope I answered the question. Okay, the next question that we are going to discuss, and that is very frequently asked and very easy question but very important, that is, what are the rights of medication administration? As we all know, medicine, it's a chemical. If we are safely and accurately administering it, it can improve the health of a person. It can treat a problem. Okay, but if we are not doing it properly, if we are not following these rights of medication administration, then it can cause a great harm to a patient. Okay, so that's the reason, to ensure safe and accurate administration of medication, we need to follow 10 rights of medication administration. They are, as you can see on the screen: right patient, right medication, right dose, right route, right time and frequency, right education, right patient education, right documentation, right to refuse, right assessment, and right evaluation. Okay, so these are the 10 rights of medication administration that should be followed for safe and accurate administration of medication. Hope I answered. The next question that is very frequently asked is, what are the blood transfusion reactions and how do you respond it? Okay, there are two parts of question. What are the common signs and symptoms of blood transfusion reaction and how will you respond it? Okay, see, what are transfusion reaction? Blood transfusion is commonly performed in emergency and in OT as well as in ICUs. Okay, so what are the transfusion reaction? Transfusion reactions are nothing but any unfavorable and harmful transfusions related events occurring in the patient during or after the transfusion of the blood components. Okay, so the most common signs and symptoms include fever, chills, urticaria hives, itching, respiratory distress, that means the patient will be having shortness of breath, hypotension, nausea, vomiting, pain at the transfusion site, red urine. Okay, there are plenty, but these are the common ones that you may come across. Okay, so transfusion reactions are actually divided into different types. Okay, that is immune mediated and non-immune mediated transfusion reaction. Immune mediated are again divided into hemolytic immune mediated and non-hemolytic immune mediated transfusion reaction, and again they are further divided into immediate and delayed. Immediate transfusion reactions that occurs within 24 hours, like within few minutes or within 24 hours of transfusing the blood components, and delayed transfusion reactions that can occur after 24 hours or even after 3 to 7 days of transfusion. Okay, so there are different types, and even non-immune mediated, they are also again divided into immediate and delayed. Okay, so as you can see here on the screen, the common types of transfusion reactions are febrile non-hemolytic transfusion reaction, which is very common. About 90% of the transfusion reaction are febrile non-hemolytic transfusion reactions, okay, which occurs within few minutes. Then urticaria or allergic transfusion reaction, anaphylactic transfusion reactions, okay, then non-cardiogenic pulmonary edema, circulatory overload, that is transfusion associated circulatory overload, and graft versus host disease. Okay, so acute transfusion reactions, they occur within 24 hours, whereas delayed transfusion reactions, they occur after 24 hours. So these are transfusion reactions. Then the second part of the question was how to respond to it. So for example, you started a blood transfusion and then you notice that the patient is having fever, chills, okay, urticaria, rash, itching, or hypotension, or shortness of breath, okay, any of the signs and symptoms that we have discussed earlier. Then what will you do? Okay, So as a nurse, we should know this. Okay, so what we have to do is, first thing is, immediately we have to stop the transfusion. Okay, and start an IV line with an NS. Okay, and place the patient in Fowler's position, and if the patient is having shortness of breath, administer oxygen therapy. Immediately inform the physician there, okay, and verify the patient's ID, ABO group of the patient and the donor unit immediately, and notify the doctor and monitor the patient's vital signs. Okay, then prepare the patient to administer prepare yourself to administer the emergency drugs such as antihistamines. Okay, we have to administer antihistamines because there is an allergic reactions, vasopressors, fluids and steroids as ordered. Okay, then you have to send the blood container. Okay, you have to send a blood sample also, blood container and the tubing and the attached label and the transfusion record. Okay, you should not discard it. Send all this back to the blood bank for analysis. Okay, and symptomatic treatment will be given. If the patient is having fever, you will administer antipyretics or leukocyte poor blood products. Okay, and if there is a septic reaction, antibiotics are administered and increase hydration. Okay, steroids and epinephrine as indicated. And if the patient is having transfusion associated circulatory overload, then the patient is positioned upright with feet dependent and diuretics, oxygen and aminophyllin are administered. And if the transfusion reaction has become very severe, the patient, they also consider to intubate the patient. Okay, when the patient shows severe, signs of severe respiratory distress, they intubate the patient. Okay, so this is how we respond to blood transfusion reaction. Hope I answered the question. See, whatever the questions asked in a nursing interview, okay, you have to answer, whatever you know, please answer appropriately, confidently and loud enough so that they can hear it. Okay, and you have to show it in your body language also. The next question that we are going to discuss is, what are IPSG goals? Okay, IPSG stands for International Patient Safety Goal that were developed by JCI in 2006 to ensure and to improve patient safety, which is a very important issue in a healthcare setting today. Okay, in any healthcare setting today. So patient safety should be our priority, and if patient safety is our priority, we must follow these 6 IPSG goals. What are they? Let's see. Goal 1, identify the patient correctly. Okay, then goal 2, improve effective communication. Goal 3, improve safety of high alert medication. Goal 4, ensure safe surgery, means like correct site, correct patient, okay, all that, site marking. Then goal 5, reduce the risk of healthcare associated infections. Then goal 6 is reduce the risk of patient harm resulting from falls. Okay, so we have to reduce the number of falls in our hospital. The next question that you may come across is regarding the urine output, like what is the normal urine output and some of the conditions related to if it is increased or decreased. Okay, so the normal range of urine output in 24 hours is 800 to 2000 ml per day. Okay, 800 to 2000 ml per day. So a person, like basically we can say that a person should urinate at least once in 6 hours. Okay, now let's see what are these, let's try to understand what are these terms. They may ask you, what is anuria? Anuria means it's lack of or no urine output. Okay, either no urine output or urine output to less than 100 ml per day. Okay, this is called anuria or enuresis. Okay, it is an emergency and it can be life threatening. Anuria happens when the patient is in shock, or when there is severe blood loss, or heart or kidney failure, or due to some toxins or medications. Okay, then the next term that they may ask you is about what is oliguria. Okay, usually they may ask what is the difference between anuria and oliguria. Okay, so we should know this. Oliguria means less urine output. Okay, so when you have low urine output, less than about 400 ml per day, then it is called oliguria. And this can happen when there is heavy blood loss, decreased fluid intake, burns, sepsis, liver failure, or surgery time. Okay, then next term that you will come across here is what is polyuria. Polyuria means excessive or abnormally large production of the urine. Okay, when the patient passes more than 2.5 to 3 liters of urine per day, then it is called polyuria or diuresis. Okay, so this can happen when the patient take excessive fluid intake, or in case of diabetes mellitus, or because of diuretics. Okay, then you should also know one more term called nocturia. Okay, nocturia means when there is excessive urination at night. Okay, so that means when the patient has to wake up from the sleep more than once at night for urination. Okay, and this can happen because of the stress, because of aging, because of the pregnancy, or when the person is taking a lot of fluid close to bedtime, or because of some infections. Okay, so hope I answered this question. So they may ask what is the normal urine output, what is the difference between anuria or oliguria, or they may ask you to define these three terms and also nocturia. Okay, hope I answered the question. Then the next very important questions that we come across frequently is regarding the emergency drugs. Okay, so they may ask you what are emergency drugs, and they may ask you to list a few, and at the same time they may ask you to the indications of some of the drugs. So we should be aware of all this. So what are emergency drugs? Emergency drugs are life-saving drugs used in patients during critical or life-threatening conditions to control the symptoms and to save patients' life. Okay, so these are life-saving medication. Let's see some of them. There are so many. Okay, adrenaline, noradrenaline, atropine, dopamine, dobutamine, calcium gluconate, adenosine, amiodarone, lidocaine, magnesium sulfate, okay, etc., etc. There are so many emergency drugs, and in an interview if they are asking us to list at least 10, we should be able to tell. Okay, fine. Then the next question that we may face in a nursing interview is regarding what is ABG. Okay, some may ask you like what is ABG, some may ask what are the important components of ABG, what is normal pH, what is acidosis, what is alkalosis, how to interpret ABG, what is Rome. Okay, so many questions related to it. Let's discuss some of it. Okay, what is ABG? ABG is nothing but arterial blood gas analysis. Okay, it is a test wherein a blood sample is obtained from the arteries, most commonly the radial artery, okay, because it is easily accessible, to measure the acid base status, ventilation and arterial oxygenation. Okay, so this test will tell you how well the lungs, heart and kidneys are functioning in a body. Okay, so the important components of ABG are blood pH, okay, PaCO2, that is partial pressure of carbon dioxide, and PaO2, that is partial pressure of oxygen in the arterial blood, and then HCO3, that is bicarbonate, and oxygen saturation, which should be between 95 to 100%. Okay, so the normal blood pH is 7.35 to 7.45. Okay, so this means that our blood is naturally slightly alkaline, or we can say our blood is naturally slightly basic in nature. Okay, so if the pH goes below 7.35, then it is called acidosis, and if the pH goes more than 7.45, then it is alkalosis. Okay, then to know whether it is respiratory acidosis or respiratory alkalosis, metabolic acidosis or metabolic alkalosis, we have to remember the mnemonic ROME, that is respiratory opposite, metabolic equal. Okay, so for that two important components that we see is pH and PCO2 and HCO3. Okay, the three important components: blood pH, PCO2, that is partial partial pressure of carbon dioxide, and HCO3. The normal HCO3 level is 22 to 27 MEq per liter. Normal PaO2 is 75 to 100 mmHg, and normal PaCO2 is 35 to 45 mmHg. Okay, so to know what is abnormal, we have to know the normal values first. So arterial blood gas analysis, to learn how to interpret this is, first we have to understand why it is done, what it is, why it is done, okay, how the sample is obtained, and what are the normal values, what are the important components of ABG, what are the normal values of these components, and how to interpret first what is acidosis, alkalosis, and then whether it is respiratory or metabolic. Okay, hope I answered the question. The next very important questions that is very frequently asked is, what are the different sites of checking pulse in a human body, or what are the different pulse points? Okay, so as a nurse we must be aware of all this pulse point. Okay, so here we are going to discuss the 9 pulse points. Okay, the first one is temporal pulse. Okay, the landmark is, it is in front of the tragus of the ear. Okay, it is in front of the tragus of the ear. If you pass your fingers along the zygomatic arch and you have reached the tragus of the ear, there. The next pulse point is carotid pulse. That is very important during CPR, that is between the trachea and the sternomastoid. Then the third one is apical pulse, which can be we need to use stethoscope for this. Okay, that is at the apex of the heart and the left side in the 5th intercostal space, mid-clavicularly. Then the next one is brachial pulse, which is in the cubital fossa. Next is radial pulse, which is in the wrist on the thumb side. Next is femoral pulse, which is deep in the groin. Next is popliteal pulse, okay, which is in the popliteal fossa. Okay, then next is posterior tibial, which is inside the ankle, just behind and below the ankle bone. Then the last one is dorsalis pedis, which is at the top of the foot in the first intermetatarsal space. Okay, so these are the 9 pulse points that we should answer it. Okay, so if you remember it from head to toe, it will become easy. Temporal, carotid, apical, brachial, radial, femoral, popliteal, posterior tibial, and dorsalis pedis. Okay, so if you remember them from head to toe in order, it will be easy to answer. Then the next question that we may come across is, when to consider intubation, or in simple words I can say, what are the indications of intubation? Okay, when will we intubate a patient? Okay, so the indications of intubation are during cardiac arrest or the CPR time, okay, or when the patient is in respiratory arrest, hypoxic or hypercapnic, or when the patient's GCS is less than 8. That means there is decreased conscious level, so increased risk of aspiration. Then before surgery, elective or emergency. Then due to neurological problems like subdural hemorrhage or intracranial hemorrhage. That means because there is a bleed in the brain. Okay, so when there is a bleed in the brain, there will be decreased sensorium and increased risk of aspiration. Okay, then when the patient is having neuromuscular diseases like myasthenia gravis, and to secure the airway in case of facial trauma or burns because the trachea is collapsed. Okay, so these are the indications when we consider intubation for a patient. It's a part of airway management. Okay, hope I answered. Then the next very important question that we may come across is, what are the components of effective or high quality CPR? CPR is nothing new to us, okay, so we know about it, but we should know what are the components of effective and high quality CPR to save the patient. Okay, so one is the compression location, that is we have to push hard and fast. Okay, push where? That is compress the center of the chest, lower half of the sternum. Then second component is we have to maintain the compression rate to 100 to 120 compressions per minute in an adult. Okay, and compression depth should be 5 to 6 centimeters or 2 to 2.4 inches. Okay, and so we have to compress hard and fast. Then next is adequate ventilation, no hyperventilation. Okay, so 30:2 is the compression ventilation ratio in 2 rescuer CPR. Then next is allow complete recoil of the chest, and next is minimize interruptions. Okay, we should continue CPR until we receive the emergency medical aid. Okay, so these are the components of effective and high quality CPR in order to save the patients. Then the next question is, what are the common causes of tachycardia? Tachycardia means what? Increased heart rate. The normal heart rate is between 60 to 100 beats per minute. So when the heart rate goes more than 100 beats per minute, it is tachycardia. Okay, so it can happen in many conditions. Okay, so the common causes are, it can happen in fever, fear, due to stress or anxiety, or when the person is doing strenuous exercise, or due to some medication reactions, in anemia, infections, or consuming excessive amount of alcohol or caffeine, electrolyte imbalance, hypertension, thyroid problems, heart diseases like CAD, heart failure, heart valve disease, etc. Okay, there are different types of tachycardia. Okay, we have sinus tachycardia, atrial fibrillation and all that. Okay, so that is again a different question, but the common causes of tachycardia are the one which I have listed before. So hope I answered the question. Then the next question that we may face is, who are vulnerable patients, or like who come in the category of vulnerable group? Okay, so vulnerable patients are those who are prone to get injured by virtue of their age, physical, mental or immunological status. Okay, so let's see who come in vulnerable patient group. Okay, one is ICU patients, any ICU. Okay, comatose patients, sedated patients, then physically or mentally challenged patients, transplant patients, dialysis patients, pregnant ladies, women in labor, physical or mental abuse patients, children and elderly. The age is, you have to follow your company your hospital policy. Okay, so different hospitals have different ages. Okay, so children and elderly comes in vulnerable group. Then terminally ill patients. Okay, so these are the vulnerable group of patients who need extra care and support. Then the next question that we may come across is, what are the different routes of medication administration? This we must know as a nurse. Okay, so there are enteral routes, parenteral routes and the local. Okay, in enteral routes we have oral, that is ingestion, the patient swallows the medicine, sublingual or buccal. Then in non-oral routes we have rectal, through Ryle's tube, through PEG and through jejunostomy. And in parenteral routes we have intramuscular, intravenous, subcutaneous, intradermal, intrathecal and intraosseous. And in the local we have topical, intraocular, intranasal, transdermal and inhalation. Okay, so these are the different routes of medication administration. The fastest effect of the drug is obtained through IV, that is intravenous or intraosseous. Okay, the effect can be seen within 30 to 60 seconds. Okay, the last question that we are going to discuss in this video is, what are the different types of hospital admission? Okay, the two main types of hospital admissions are, one is emergency admission, which is also called as unstable admission or unplanned admission, wherein the patient is getting admitted in acute condition which requires immediate treatment, like for example in case of stroke, in case of road traffic accidents, in case of any cardiac or respiratory emergencies, in case of acute appendicitis, severe burns, in case of poisoning, Okay, so these are the different conditions. These are just, I gave some examples of the different conditions wherein, the admission into the hospital is not planned. It is unplanned, emergency and unstable, which requires immediate treatment. Then the next category of hospital admission is non-emergency or stable admission, which is pre-planned, or we can say it's a routine hospital admission. Okay, that is like in case of fever, diarrhea, vomitings, okay, planned LSCS, planned surgery, okay, for a routine checkup in case of hypertensive diabetic patients, bronchitis, etc., etc. Okay, so these are the two different types of hospital admissions. Hope I answered the question. So thank you for watching. Thank you for listening patiently to me. Okay, so if you find my videos interesting, effective, the content is good, then please subscribe my channel Nurses the Heart of Healthcare, and do like, share and subscribe. Okay, so nursing interview, it is very important. So some of the questions that are frequently asked is what I have discussed here. 15 questions here, altogether 15 questions are discussed. So hope it will be helpful to you. Thanks for watching. Stay connected to Nurses the Heart of Healthcare. Thank you. Have a great time.